Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to California State Senator Dr. Richard Pan about threats to public health officials in the era of COVID-19. Let's listen. So, Dr. Pan, thank you so much for joining me today. When I read yet another story about health officers who are being attacked online or fired or being forced to quit, I think there are now dozens across the country in the middle of the pandemic. I really wanted to talk about this with someone on the podcast, and I couldn't think of anyone better than you. Could you start just by introducing yourself to our audience?
No, sure thing, Dr. Sharfstein. And really, I want to thank you for having me on your podcast. I'm Dr. Richard Pan. I am a state senator who represents the Sacramento area, and I chair the health committee for the state Senate in California. I'm a pediatrician. I, in fact, trained out in the East Coast, came out to be a faculty member at UC Davis, actually to teach social determinants of health, ran the residency program. So was involved in the community and was there for 12 years. And then because I got frustrated during the Great Recession, ran for the state assembly and won. And so I've been in the state legislature for 10 years and worked on a variety of different issues, including trying to strengthen our public health infrastructure and vaccinations, as well as, of course, expanding access to healthcare. But because of my work around public health, I've certainly run into some of the experiences and have witnessed many experiences that public health officers are facing now.
So let's talk about that a little bit more. What do you think is going on with all these attacks on public health officials?
Unfortunately, we are in an era where we are divided. It's hyper-partisan, but also there's been erosion of trust in our institutions. And public health is actually a collective activity, right? A lot of public health depends on people working together. But we've also are in a situation where there is tremendous division. So as public health leaders are trying to combat this COVID outbreak, this pandemic, they are asking people to do things to try to slow this pandemic down. And yet we have other people out there basically opposing every effort to stop this disease. And they are giving a platform and a megaphone by social media, but unfortunately also by some political leaders as well. And that's making it very hard for public health leaders who are brought on for their expertise and knowledge to then have to go up against politics and the tribalism that some people have adopted in terms of how they view how they should act in their communities.
I think one of the hardest thing for public health officials to appreciate is, why, if you disagree, don't you just go through the process to express your disagreement? Why the hurtful comments online? Why the protests on my front lawn? Why the doxing? All these things that are happening. That usually doesn't happen when it's just a question of a water permit or something else that the health department's doing, or a stop smoking campaign. Why does it cross the line? And you have such a unique experience because you see the politics and you're a pediatrician, have this background in public health. What would you say to health officials who are wondering that?
So unfortunately, what's happened is that many people who oppose public health measures also oppose government, they oppose big corporations, and that's how they view it. And they feel like the way to get their way is to essentially bully and intimidate. And social media has given them the tools to both organize and also incite this type of behavior. And this is a huge challenge, certainly for public health. So, by the way, this did not begin with COVID.
Yeah.
So I found it fascinating that Anthony Fauci, who has spent his career fighting infectious diseases, HIV, and now COVID, is talking about his surprise that not only himself, but his family are being threatened with death threats and they have to have protection. But by the way, those of us who've been advocating for vaccination pre-COVID, we've already experienced this.
Yeah, so I want to talk to you a little bit about that. I mean, some of these attacks must be giving you a little bit of a feeling of deja vu.
It has. So I will point out that just the last year, I authored a bill to have public health oversight over medical exemptions for vaccinations. The opponents, not having science on their side, engaged in very violent rhetoric. They had rallies with pictures of my bloodied face at the front of the rally. They wore T-shirts with that image. They mailed bricks to legislators. Of course, people got death threats. And in the end, what happened was that I was assaulted on the street by an anti-vaccine activist, or extremist actually, who had actually been harassing me in my community for many years and finally decided to assault me on the street. And then another one actually threw blood from the public gallery onto the Senate floor when we were in session. And just to keep in mind, that has never happened before in the history of California, that someone has actually thrown something from the public gallery onto the floor during a session of the California State Senate or the State Assembly for that matter. So the fact that they felt justified in engaging in this kind of violence basically shows that this is part of their strategy, right? And what we then saw with COVID is that you have people carrying weapons in front of the houses of public health officials as an effort to bully and intimidate them, calling out their addresses during meetings so that people could go and harass not only themselves, but their families. It's about bullying and intimidation. It's not about expressing a position.
Yeah. What was that like for you to have that terrible experience?
Well, actually, unfortunately, I've had this experience since I started doing legislation to try to improve vaccination rates. So when I did SB 277 to abolish non-medical exemptions, my staff and I got death threats, including other legislators. Some had to close their district offices. They were so worried.
That was after the measles outbreak, is that right?
Yes, that's a 2015 measles outbreak. Some of my colleagues, they closed their offices because they were so concerned about the safety of their staff. Even after the passage of that particular law, I've continually received death threats and harassment, particularly over social media. We know they organize over social media as well, particularly Facebook and these closed Facebook groups. And by the way, we see this not just around vaccines, but around other conspiracy theories as well. But then you think about families and other doctors as well. And I really want to recognize Todd Wolin, who's organized a volunteer effort to help defend pediatricians like Nicole Baldwin. So this is not just limited to people like myself. I'm an elected official. There's a certain bit of that goes with that. But they are attacking doctors, and they're attacking even parents of children who've died or have suffered from vaccine-preventable disease with harassment and threats.
So it's really a kind of the emergence of this very aggressive and sometimes violent and illegal kind of tactic.
And unfortunately, these tactics work because people are less likely to say something because they're afraid of this. I understand some doctors have talked about if they have employers or people they work with, they tell them to please don't because we don't want to attract that attention. Interesting enough, now this isn't related to vaccines, but even the Facebook spokesperson was afraid to say something about who they were because they're afraid they'd be attacked by the QAnon people about the QAnon groups on their own platform. So even the platform people are so afraid of their own platform and being harassed. And so we see this activity going on against physicians, against parents, and then now, unfortunately, with COVID, against public health leaders.
Is the connection just the tactic, or is it some of the same people and organizations that mobilize against these different public health measures?
Well, it does seem like there's a merging of these things. So, for example, we have identified that many of the leaders of the rallies that oppose public health measures against COVID, whether it's at the state capitol or locally, were led by the very same people who also opposed the vaccination bill. It's the same people, but they've also teamed up with other extremists, white supremacists, other Second Amendment extremists to basically go out and bully and intimidate. So they try to find the home addresses of public health officers to go and attack them at home and their families, not just in public spaces. So certainly everyone has a right to petition their government, and we need to protect that right. But when you're trying to sway people through bullying and intimidation instead of through facts, that becomes a danger to all of us during a pandemic.
Absolutely. And what have you been able to, do as a California state senator? Have you thought about different protections that could be put into place, either to protect the work of legislators or to protect the work of health officials, recognizing that we're not talking about shutting off dissent or not giving people a chance to express their views, but really focusing on the violence and the harassment?
So I think one of the challenges is that social media companies are essentially immune to any liability for this type of violent rhetoric, which unfortunately it's not just online, it translates into real world, okay? I think sometimes people go, it's just the trolls, they're just, sticks and stones don't break. But the problem is that the sticks and stones actually sometimes become real, all right? They're real life. And when I talk about people like Nicole Baldwin, she wasn't just harassed in her home. She actually had to have the police at her practice, right? We've had numerous examples where essentially this online harassment then translates into real world threats. And we need to do more about that. Ideally, our social media companies should step up and do that on their own. They're private platforms. They have the ability to do this. But unfortunately, some of them, I think some are taking some steps. I think Facebook in particular has been particularly slow in trying to stop this kind of harassment. In fact, CNN did an article where they presented harassment parents, not just doctors, parents, as well as doctors. Facebook said they'd investigate it. They recognized that it violates community standards. 9 months later, they did nothing. So that's a problem. And we need to set new norms of behavior about social media and this type of bullying and harassment because it's having real world consequences. I would also mention is that unfortunately, this has also led to people who are elected and political leaders, some of them deciding to pander or cater to these groups as well and not support public health officers. They're worried about them politically. And, recently you had a QAnon, candidate win, essentially a primary. They'll probably end up in Congress, conspiracy theorists. We have the anti-vaccine groups have been active in trying to do campaigns as well, engage in political activity. And at some point, we also need to think about, as a community, how we push back against that, because we are talking about people's lives being in danger. We have over 160,000 Americans dead. And yet at the same time, we have public health officials who are in the front lines trying to slow this disease. And they're not getting enough support from some of their elected officials. And they're not getting enough support from social media companies that continue to platform bullying and hate and intimidation. And unfortunately, some of them, rightfully, I can understand, said, I've had enough. I'm not doing this anymore. And we don't have enough public health experts in our country to have this continue to happen.
So higher expectations for social media companies, perhaps more protection for public health officials if they need it?
Well, I'd say both more protection, but also more support, right? I think the medical community has been standing up and saying, we need support of public health officials. For example, down in San Diego County, a public health official was being attacked. In fact, her home address was read out at a board meeting, and the San Diego Medical Society waged a social media campaign to express their support for the public health officer. But we also need to have elected officials. Unfortunately, in Orange County, the board of supervisors did not back up Dr. Quick. You can disagree with your public health officer, but you need to support your public servants and say, they're trying to do their best job. It's not acceptable for people to attack them at the Board of Supervisors meetings. You're chairing that Board of Supervisors meeting. There is acceptable and unacceptable behavior. You can certainly criticize, that's fine, but threats and doxing and bullying should not be acceptable. We need to see elected leaders standing up and saying, we can have differences of opinion, but that crosses the line.
What's at stake here, do you think?
The stake is our health and our lives, right? I mean, we have over 160,000 Americans dead of COVID-19, and it's not stopping, right? We had a largest outbreak of measles last year since 1992, all right? We have outbreaks of pertussis and other diseases when it comes to vaccines. we want to talk about climate change and other types of things, environmental effect. This is a real world threat to our health when our public health leaders are not being supported, and they are basically being subject to very personal attacks, particularly women. I would point out that's very misogynistic. Particularly the women are under personal attack, not only themselves, but their families as well. That is not part of the job. That should not be part of the job. Note that historically, it's challenging to be a public health leader during a pandemic, and that we certainly can point to historical things where they've also been harassed and attacked. But I think that what we're seeing now, especially with the amplification by social media, is really not just problematic, it's dangerous. In fact, the World Health Organization, which unfortunately, again, we politicize a relationship with the World Health Organization, said that the infodemic is just as serious as the virus itself. So we have two viruses. We have the virus, the actual virus that's infecting people and killing people and hospitalizing people and causing long-term damage. And then we have the infodemic, the virus of disinformation online, which unfortunately is discouraging people in the United States in particular from taking the steps they need to do, undermining the trust they have in the experts, undermining our ability to contain this virus.
Thank you for everything that you're doing to keep focus on science and evidence, to defend public health officers, their ability to at least do their job without harassment and violence, and for your work on vaccines.
Well, thank you very much, Dr. Sharfstein. Really appreciate this opportunity to talk to you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.